Madam Speaker, I rise today to share with you the story of Suzanne Perry of Parker, Colorado. Now, Suzanne lives in Parker, but might as well be Los Angeles, California, might as well be Billings, Montana, might as well be Dallas, Texas. This is the story of, could occur anywhere in this country. Suzanne is a breast cancer survivor. She had 13 of 16 positive lymph nodes and came very, very close to not making it. Suzanne took a high dose of chemotherapy, radiation, bone marrow transplant, bilateral radical mastectomies to save her life. Because of those dramatic interventions, she has significant scar tissue under both arms that continues to tighten, making it very difficult for her to even lift her arms to write or to hug her 4 children. The insurance company declined her doctor's request for scar-releasing surgery. They said, oh, that is cosmetic. She had to take her case. Suzanne took her case all the way to the top of the insurance company's appeals chain. When she arrived at the insurance company's conference room to discuss binding arbitration, there was a group of men sitting around the conference room holding copies of a picture of her bare chest, which had been submitted by doctor's evidence. Suzanne says that was unquestionably intentional. It felt demeaning and humiliating for me, and it certainly made it more difficult to present her case. Imagine going into a room filled with a bunch of men, all with pictures of you naked, showing your breasts and your scar tissue. Ultimately, the arbitrator ruled that Suzanne could have the scar tissue released on one side, but not the other. That was akin to untying one arm from behind my back, but leaving the other one tied, or akin to perhaps King Solomon's famous solution to the issue of whose child was it when he was presented with 2 mothers claiming the same child, and he recommended that they cut the child in half to find out which mother actually cared more for the fate of the child. And that's frequently what arbitrators do. They split the difference. That's a commonly known theme. I have a business background, and in our judicial system sometimes, if you take a case to court, they might decide whole hog one way or the other. If you go through a binding arbitration process, it's very, very common, doesn't always happen, but very common, the arbitrator will try to split it down the middle. In this case, it meant she can lift one arm, but she can't lift the other. By providing Americans more choice in health care coverage, we empower consumers to choose the insurance company of their choice. In a market system, it simply doesn't work if 1 or 2 companies in a monopoly or oligopoly have an 80 or 90% market share, as is the case with insurance in many markets in this country today. Through the exchange, we're providing a very vibrant and active marketplace where dozens and hundreds of insurance companies can compete, as does the public option. People like Suzanne will have the ability to go to other insurance companies, to not be discriminated against based on their pre-existing condition. And hopefully any insurance company that forces a woman to fight for a surgery she needs by showing up to a boardroom with 12 men and naked pictures of that woman's chest, that insurance company should lose business. And they will under any plan in which they face real competition. And that's exactly what the Democratic plan does. And that's why Suzanne's story should be powerful testimony as to why my colleagues should join me in supporting health care reform. Thank you, Madam Speaker.